Hello, my name is Katie. First of all, I'd like to set the scene and explain the following discussion will be focused on both technical and non-technical skills in nursing students at a bachelor level. Throughout the discussion, I'll focus on simulation-based learning and testing, with my input as to why I feel this is an effective learning assessment and why I would support this method. So to elaborate, an effective simulation would achieve the intended learning outcomes, or the ILOs, that were originally set. The chosen assessment task is simulation in smaller groups, incorporating the use of role-play. This method of assessment has been redesigned to focus on smaller groups to ensure all members have a vital role within the learning environment. The assessment task of smaller simulations in the learning environment have been used as an effective tool to promote maximum student engagement by incorporating the intended learning outcomes through simulation. Experiential learning can have a positive influence on evolving learning into knowledge through practical elements such as a simulation environment. This method can be utilised to prepare the learner for the workplace. This is also known as James's third generation of assessment, or authentic assessment, problem-based learning. Assessment has evolved over the years. Mary James outlines this through identifying three generations. First generation, or behaviourism, focuses on the teacher teaching and the student learning. This is a more summative approach to learning. The second generation, or constructivism, focuses on enhancing a deeper understanding from the learner. So what is taught isn't necessarily what is learnt. And the final generation of authentic assessment, or problem-based learning, shifts learning into an experience rather than a theoretical approach. David Kolb's theory is commonly used in higher education to enhance the learning process through experience. This theory focuses on developing the learning experience into a deeper level with the use of experiential learning. Sessions are structured around 4 learning cycles, which are concrete experience, reflective observation, abstract conceptualization, and active experimentation. An example of experiential learning would therefore be clinical simulation. This can involve all types of participants, from your novice through to your expert. A simulation needs to be guided by clear ILOs with the use of a valuable teaching method that can enhance critical thinking. Sims are structured within a safe environment, and this is to allow all participants to learn throughout the experience. The learning method of simulations focuses around an important component of reflection, which will guide the learner to experiment within the learning environment. Assessment drives the learning process. Therefore, a clear link between the ILOs and what is expected must be identified to ensure the learner has an understanding of what they are expected to learn and why this would be relevant to their chosen workplace. There's minimal impact when the student can't link the relevance to their intended knowledge. The chosen framework of Miller's pyramid can be used as a model for assessing clinical competence. Miller implemented the framework to be used as a guide to assess the level of health professionals' clinical competence in a pyramidal-like structure of the knows, how, the shows, and the does. The original pyramid design is hierarchical in regards to the does should demonstrate an expert level of knowledge. This framework is an effective tool when focusing on the simulation learning environment, as the knows may not necessarily know how to apply their knowledge. Universities focus on developing a sound knowledge for the learner through theory. However, the clinical environment would require further understanding of the does. This is the intended level from an expert practitioner, and they can gain this experience over time. But by implementing simulation through learning, this could also enhance the development of knowledge as it focuses on an experience-based learning. I quote, simulation-based testing methods have been developed to meet the need for assessment procedures that are both authentic and well-structured, unquote. Understanding the need for both authenticity and validity in the simulation environment is balanced through the structure, the content, and the length of the sims. The purpose of assessment through a simulation must be identified from the teacher. So what do we want the students to achieve from this learning experience? And what are our ILOs for the simulation experience? If the ILOs aren't clearly identified at the beginning, then the simulation-based training will have little to no effect on enhancing the learner's knowledge. Also, we need to consider, do the ILOs fit in with the Australian Qualifications Framework, or the AQF? The AQF is divided into 10 levels of education, and this guides the curriculum for higher education. In a bachelor's degree, the graduate would have an advanced knowledge and skill set for the intended profession. Therefore, the use of simulations and experience learning would have a great impact on students developing a sound skill set for the workplace. In clinical professions, there's a heavy focus on knowledge from a theoretical perspective, which is important to ensure the future practitioners are graduating at that level intended. However, the skill sets can't develop without some form of simulation-based learning or experiential learning. This links back to Miller's pyramid of the nose, reflecting a novice practitioner. In simulation-based testing, the design needs to incorporate a balance between authenticity and validity. Are the ILOs going to benefit the learner, and how would they apply this knowledge into their practice? The simulation should be designed to incorporate this. The method of assessment I've chosen is peer review and reflection. This can enable all participants to reflect on both their own experience but also the other members from the simulation. Debriefing or reflection components are the most important aspect to all sims, as this identifies certain issues of what went wrong and why, and how would we improve this or do things differently and why. This component of reflection will allow the learner to link their experience with their knowledge. This therefore enables the learner to understand the relevance of the knowledge in order to apply this within the clinical environment. The steps I've chosen to ensure the maximum learner involvement is reached through simulation-based learning experience are to focus on smaller groups. So look at designing a sim that would incorporate all of the participants. For example, a sim of a cardiac arrest within the resource environment. This would allow for 5 participants. The 5 participants are then given a role to participate in focusing on the real-life scenario of the clinical presentation. I would set up the sim with a patient, a circulatory nurse role, an airway nurse role, a scribe role, a lead practitioner role, and 1 observer role. Decreasing the amount of observers in a sim could also decrease the anxiety level of the performers, and so a lesser crowd to watch and critique. Consideration into the scenario purpose would be another step to ensure maximum involvement. This particular scenario would be practiced once the learner has a sound understanding of the critical nursing component. This would not be an appropriate simulation for a first-year nursing student. They've not yet developed an understanding of clinical practice, critical nursing, or critical thinking. So in order to effectively assess the simulation, the teacher would need to apply all of the above content to allow the learner to learn on a deeper level. This would involve an adequate preparation prior to the simulation, identification of the purpose and the ILOs to ensure the participants have a clear direction and understanding of what is expected from this learning experience. Also, time allocated for the reflective process, as this is the most crucial element that would link it all together. This leads with the posing question of why is there still a heavy focus on theoretical aspect of learning within a bachelor degree of nursing, when the experiential learning such as simulation-based learning can be used to better prepare the student for the workplace. As an employer, would you prefer someone with a high practical experience versus someone who is theoretical-based trained with minimal practical experience? That is all. Thank you.